Okay. Good evening, everyone. Tonight is our first official revamp meeting for the Illinois Community Pharmacy Enhanced Network. And let's get started. Okay, so a few things before we dive in. This is our IPHA antitrust cautionary statement. This meeting is recorded, and the slides will be sent out after this, so go ahead and read this on your own time. And then since this is our first official CPESN USA meeting, these are our antitrust guidelines. So this meeting is for specific purpose described in the agenda. CPESN meetings are conducted in accordance with the antitrust laws of the United States. All participants should limit discussion to the topics set forth on the agenda and to the activities of the local network. Participation in CPESN networks is completely voluntary, and any questions or concerns about the antitrust or any other legal matter should be directed to the meeting leader. There should be no informal, secret, or rump meetings in which some or all attendees discuss business matters off the record. Their disclaimer is, as a reminder, this webinar is a production of CPESN. The use of any recording devices, including but not limited to audio, video, or AI-enabled recording devices during this webinar is strictly prohibited. Copying or distribution of audio, video, or any other form of recorded content obtained during this webinar is also strictly prohibited without the express written consent of CPESN. Any questions or concerns about these guidelines or about any CPESN meeting, discussion, or practice should be directed to CPESN USA LLC's Antitrust Counsel, Katie Funk, who may be reached by this phone number or email. Okay, so let's welcome you all to the team of I-CPEN. So most of you know Garth Reynolds. He is our network account manager.
Hello.
Then we have Starlin Hayden Greeting, who is our lead network account manager.
Hello.
Myself as the managing network facilitator. We have Michelle Dyer, who is unable to make it today, but she is also our lead network facilitator and a lead luminary. We have Miss Laura Licari, who's our managing network facilitator.
Thanks for being here.
And we have Jill Woodward, who is our CPESN USA board representative. Alrighty, so tonight's agenda. We're going to give a brief overview of what CPESN has done nationally. Garth is going to give us an IPME update. Starlin will give us a CPESN quality assurance standards overview. We'll also go over provider billing and cash services that are legal to do now in the state of Illinois. We'll establish upcoming and recurring meetings. We also are going to provide current resources, and then we want to hear your voice. So we do have a brief survey and then a CPESN national survey. So just a few, this is very few things that CPESN National has done. So they've been implementing over 350 payer programs, and you can see those on the right over here. They've involved over 3,500 pharmacies and had involvement with over 8,000 pharmacists providers. And with that, over 100 of these active payer programs, one of these programs generated $12 million that were distributed over a little over 400 pharmacies, which then totaled to a little more than $32,000 per pharmacy. And then more information and success stories can be found on their website, which will be linked in this PowerPoint, but we'll also send you that after this meeting. And I'll hand it over to Garth.
Thank you, Lauren. In addition to IPHA, as most of you are aware, we have different subsidiaries that handle different functions for our membership, whether it's the foundation or political action committee. one other subsidiary that most of you may not be as fully aware is our for-profit entity, which is Illinois Pharmacists Management Enterprises, or IPME. This historically has been around since about the late 80s, if not right around 1990. And it was pulled together and oversaw to help with taking some of the aspects that the association may not fit quite under the association's umbrella, but to help kind of push these elements of pharmacy going forward. One of the biggest aspects in its early days was taking a sample of energetic IPHA members and implementing a lot of the provisions of OBRA 90 and taking the steps to transform their practices utilizing the new pharmaceutical care modeling. We had 5 pharmacies throughout the state. 3 that I can remember off the top of my head was Marlon Weekly's pharmacy operations, Steve Bandy's operations, and my parents' operation. And those pharmacies helped establish the models for other pharmacies then to incorporate with how to deliver pharmaceutical care. And that just shows you in one aspect of this type of interaction between IPHA and trying to help build pilots working together in partnership is not a new idea. And so a lot of this advanced with also looking at with medication therapy management and medication optimization, because of the structure we had at that time, some of this came back to the foundation. And we had the patient self-management program with PSMP. That's a name that some of you probably have heard before. And the Illinois Pharmacists Network. And all of this comes together that we brought Starlin on board to help with pushing this element forward in research and communications and building these steps for us all to kind of come back together as we started in 2017 of revitalizing IPME, and especially as CPSN USA came about. And of course, as we started to ramp that up, we've gotten to that nasty aspect that put us all into a little bit of a hiccup called COVID. And to be honest, it's taken us about this long since COVID to really get ourselves together again. So we're really looking at this as a relaunch. And as Starlin has utilizes the term of PSMP 2.0, and really looking at how IPHA through all of its different subsidiary factions, whether it's the foundation, the association, or here through IPME, and well, we'll talk about the network here in a minute, but all of these different aspects are going to be an umbrella to help provide you guidance and access to programs either through us as a network or an administrative billing hub, or through the national, through USA, because USA's got its own programs as well. And so, we're going to be working on developing some of our own services based on what we can do here in law. And some of that's going to be establishing, expansions of encouragement of naloxone access and immunizations, but also most importantly, the billing aspects as a provider for reproductive health care services, HIV PrEP and PEP, and the most recent test and treat for the various conditions. So our network, we already have 50 stores that are part of the local network through the contract agreements through CPSN USA that have stated that they want to be that they are a part of the Illinois network. Now, one of the things that we have not done in all that time, for good or for bad, is that we have not charged dues for the network. There have always been the monthly dues for CPSN USA. But we have not charged dues from the network. That has to change as we go forward, so we can help build the infrastructure that we need to be able to help you better. So we're actually looking at that will be a $50 assessment that would be on top of USA's $95 a month to help with providing us direct support and being able to assist you as we move forward and grow this network to make us all stronger for our patients. So one of the things I did, Lauren, if you can go to the next slide, I just wanted to remind pharmacists that, especially those of you who've been around for a little bit, with the Illinois Community Pharmacy Enhanced Network. The network's not going away in the terminology. We're just formalizing it under the umbrella of I-PME. And as a reminder, and some of this should look familiar to you because a lot of them are USA mandated services to be part of their network, like the CMRs, do comprehensive medication reviews, the immunizations, the MedRec, the MedSync, and the personal medication records. We added naloxone to be able to make sure that you were a part of Illinois, and that's something we may be adding additional services as we move forward. But that also where we need to make sure that this is a conversation as members of the network to help us with being able to focus on what best needs that you're looking for. And that's one of the reasons why Lauren has that survey that she'll be talking about here shortly. Go ahead, next slide. Before I turn everything back over to Starlin and to Lauren, are there any questions on like the history and kind of the foundation, the directional foundation for where we're going with I-PME and I-CPEN on the network side? Okay. Oh, why is it not just Illinois CPSN? Chad, that's a really good question. There was a lot of conversations when we were first trying to come up with a name. We wanted a name that stuck out a little bit more, and that's where we came up with the Illinois Community Pharmacy Enhanced Network. And at that time, we were still kind of floating the idea of where it was going to be housed, whether it was going to be under the association or the foundation or under, as we've put it now, under the for-profit arm. And some states do use the CPSN space insert name of state, but not all have. Pennsylvania is one that does not, and so we're unique in that respect. But that's one thing where I'm glad you brought that up, because when you go to look at some of the questions for CPSN, especially on their self-assessment, when it comes to recognize your network, you'll need to go down to the I's, because there'll be all the CPSN insert state name, and then we'll be down in the I's. Someone said, I understand the dues being needed. However, do you have a list of what those dues will be going towards within the state network? Yes, we'll be glad to provide that. Sorry, I thought I was trying to get somebody into the chat from the lobby here. Yeah, JD, that's a really good question, because what this is going to be going for is being able to help provide staff support and resources, because it's going to take us some additional funding to be able to develop these resources, whether it's the billing manuals, the standing order templates for you to utilize, the webinars and CE development, and the educators' times to pull this information together. And eventually, hopefully be a full-time staff or staffs members to be able to help support all of this. And that has to be coming from the network. And I think I'll be honest, probably not one of my leadership misdirections that I did was, and not misdirection, just mischoice of action, was that we didn't start charging these dues from day one like USA did. Because I felt at the time that I wanted some programs under our belt, and I didn't feel comfortable during COVID. But USA was able to. They were able to continue to build their structure and infrastructure, and so being a little bit more conservative on it instead of being more stricter on the business mindset that we demand that we got to have funding to be able to get this off the ground. And so I'm always one to admit whenever I make a mistake, and that was one of them. So I'm glad that we're going to go forward here. We're going to get support from the stores to be a part of this, and as everyone grows, we'll become stronger. Lauren and Starlin?
Okay. Well, first of all, I want to thank Harry and Jill for all the hard work they did, because they carried the ball for this for most of the time. And it is, as CPSN grew, more tasks went on their list, and trying to run your own pharmacy in these days and times and do the tasks that it looks like it's taken about 5 or 6 of us to do. I want to give them all all my support and love, and they continue to help us today. I was not allowed to be part of this from the beginning because I was funded by CDC grants, which originally CPSN had their own CDC grant, and they did not want the two grants. They didn't want me double dipping, so to speak. And now that CDC and CPSN and the state public health departments have a better idea of what a CPSN network is, what a great clinical pharmacy practice network is. Now in these new grant years, if they get released, we can be open about it. But they had me in a pillar, and so that I stayed in my lane and assisted Garth or Harry or Jill or anybody if they needed anything. So the quality assurance standards were started back in 2023. They're fairly new. All of you regular members would have gotten emails with lots of information on it for you to go in and read and learn. It's could be overwhelming if you went and looked at that page. It really comes down to three things that the entire network, USA network, is wanting all the networks to do, so that when they go and bid for these national contracts, we're all on the same page and we're all at the same higher quality, and we're a better service enhanced network. Quality has been my background since I was the Illinois Medicaid Quality Assurance Director. So that's where I'm playing a role. The first thing that we need everybody to do, not only we get a quality assurance point from CPSN by filling out our pharmacy self-assessment. And this is a long survey, so it's not a 3 question. It's basically a demographic of everything that you do, so that it goes into, so instead of me just getting a name and it tells more about what your pharmacy is and what you're doing, it creates a clinical profile of your pharmacy for the USA. And 1 copy comes back to you to keep for your records, and then our network here gets a copy of that, so that if we need to put some details together in a certain area, we have your background. Kind of like we had a clinical pharmacy network demographic page that we still have that, but this is more about you and your pharmacy and all the services that you provide. Then the second thing is implementing an opioid stewardship plan. And Garth already mentioned the naloxone. The naloxone process is part of this opioid steward plan. So if you're already doing providing naloxone, it is part of that plan. And we have a template that you can use to put into your program and attest that you have implemented an opioid stewardship plan. And we're already, I'll go to some more details later, and we'll be sending you more details of all this. They're very thorough on everything that they do. I'm very impressed with their resources. And then the other, there are 2 metrics that they really want you to try to pick out. One is in one section is to send e-care plans per quarter if you have that ability with your pharmacy software. And then there's some other alternatives that we'll go over. Next slide, please.
Starlin,
Yes.
Starlin, one thing Harry was mentioning in talking about some of the other aspects, is he said was like credentialing providers.
Yes, so that's part of the reason why this self-assessment's there, because if we can collect all that information and have it in one spot, then it'll be easier for you to fill out your credentialing when we start enrolling in some of these plans. Even to do the managed care Medicaid plans, you first have to be enrolled and credentialed in Medicaid and manage Medicaid plans. So, and when we do that, you'll have your package ready for when hopefully we can land Blue Cross Blue Shield or something like that. We're hoping. Okay, so this is just the same thing that I just said. You'll get this. The deadline for the M&Fs to attest that you have provided some of these functions, all these function is February 21st. After that, you'll start getting emails asking you to attest yourself. And right now we have 12 pharmacies that are actively doing most of this. We have not attested to the opioid plan yet, but that's in this year. This is what we need to do before March. Next slide. So this is the detail of the basic metrics. So in measure 1, that's the area where it shows that you can do e-care plans, 10 e-care plans sent in electronically per quarter, or you can do measure 2, which is if we had a Blue Cross Blue Shield, we would be in a payer relationship, and that counts toward measure 2. But we are going to work on trying to have our Medicaid payer in Illinois to be one of our payer programs, so that once everybody's enrolled in that, you'll get credit on quality for being enrolled in Medicaid and providing some Medicaid evaluation and management services. The other section, which is the quality-based metric set, if you're in the process of transforming, thank you, Lauren, you can pick one of these and we can help you with that. Some of it is if you're just starting, and we're all starting over. So some of this is just you're in the transformation phase, which is trying to get things together, and then we can attest to that. So that's just, next slide. The most important one is the opioid stewardship plan. And as you can see, I've outlined on this slide the naloxone for patients at risk for abuse. So I have several, Rupesh has been very successful in being able to bill for providing naloxone to his patients. And so we thought this would be a very successful process for us to deploy and actually get paid for some things. And this is the plan that you can, this is the example template that you can use for your stewardship plan. It's just very basic. And go to the next slide, please, Lauren. This is more detailed, and you'll have copies of all of this as well. And it shows you the steps that you can go through. Every one of the blue lines is a link to like the morphine calculator, or you can go to a fact sheet that you need. So they've done a very nice job of providing materials for us to utilize without us having to create it from scratch. Next slide, please. So basically what we need to do for the quality for our performance from 2024 is to do that self-assessment, and then start your opioid stewardship plan. And then if you're doing some quality metrics, and you can provide an e-care plan to try to do 10 of those per quarter. Now, if you can't, we just need to know why. And some people may not have this a pharmacy software that's doing e-care plans. Most of them have rolled that way, but that's what in the assessment you'll be able to answer some of those questions, so that we can try to help fill in those gaps and help you along the way. Next slide. So I'm going to just talk a little bit about the Illinois Department of Public Health and the UIC, which is the Chicago area grant opportunities. We are bringing the opportunities for network members first to be able to provide diabetes self-management education and or diabetes prevention, which is basically our lifestyle program. For the lifestyle program, we're team-based teaching the diabetes prevention program. So if you have a super tech or a super student that you have all the time, they do not have to be a pharmacist or a doctor or a nurse. They can be an auxiliary pharmacy staff person, and they can be part of our lifestyle program, and we have grant money to pay them, and or we can do block grants for the pharmacy if you provide the pharmacy student or pharmacy tech. Or if you as a pharmacist want to do it. For DSME, the primary focus on DSME, diabetes self-management education, and diabetes self-management training is provided by a pharmacist, but we have been working to also be able to use pharmacy technicians to help with like 50% of the teaching, so that the pharmacist is doing the clinical basis and the pharmacy tech can do the paperwork and nutrition. Some of the same things that you cover in diabetes prevention are taught in DSME, so you can kind of team teach with your tech on that one. Then we have a cardiovascular grant, CDC grant, that has blood pressure self-monitoring blood pressure program, and that the Healthy Heart Ambassadors is geared toward pharmacy technicians and student pharmacists, and Lauren, along with another pharmacist, is gearing up toward talking to each of the schools of pharmacy so that we can maybe pair in with Operation Heart with their APHA ASP chapter, and get some credits, and also work along with their local pharmacy that they may be working at or on rotation with. The other, for the pharmacists, we have the Million Hearts program. Excuse me. We also have money left over from the tobacco settlement. Back when I was in Medicaid, I helped grab some money for the state of Illinois for that. So we have some asthma self-management program, and some of you have already benefited from getting a grant to go to an asthma online program to beef up your asthma training skills. And then recently, we've been working with Illinois Advantage and the Illinois American Lung Association Tobacco Quit line, and they are considering creating a referral process that will be enumerated for. So those are the other openings to expand your clinical services in your pharmacy. Lauren?
Thank you, Starlin. So training and education. So pharmacists are allowed to prescribe hormonal birth control in Illinois. That is in the law. What we need to get involved is to enroll you guys, pharmacists, into Illinois Medicaid. And so me, Starlin, and Garth have worked and are still working very hard with Medicaid so that we can have a seamless process of getting you guys enrolled in Medicaid. And those conversations are happening on a regular basis. So to be determined and expected is full training, training and educational videos. And that also comes with CLIA licensing, and that's for test and treat. Right now, you guys as pharmacists can do test and treat, but for cash. Garth, I see you unmuted.
Yes, I just wanted to kind of touch on a couple things, and I may be jumping a little ahead of where you were going, but just on the Illinois Medicaid, and what we're talking about here is this is in addition to your impact applications that you manage for your actual pharmacy. So we'll be looking at impact enrollment for each and every one of your pharmacists, because the pharmacists are the providers on the patient care services. So yeah, that's going to take a little bit of time, and that's one of the things that we're working on. We've had one applicant that we have put through the process, and they were successful. That's in addition to, we know one chain has put in 350 applications, and some of those are still in process. So the department is still trying to figure out some of the nuances. It's been a little bit of a challenge trying to get some commonality on where our barriers are, but as Lauren mentioned, we are working diligently on trying to get that to a completion. One of the things, and that would be, she mentioned just for hormonal contraception, but this is also then be bridging over to PrEP and PEP and to test and treat as well. And so one of the things that, to help get yourself prepared and ready for whenever we can go through that, because one of the aspects to be able to apply for provider enrollment in Medicaid for contraception and for PrEP is that you have to have completed the training programs, a training program. And so one of the resources that Lauren will be sending out to you will be the listing of the programs that we have contracted with or have reviewed for completeness on IPHA.org. And then also she'll be sending you a video that some of you may have been on the webinar back during the primary phases of COVID on how to obtain your CLIA license, because that still can take a little bit of time, especially since the state has to approve it and then send it to HHS. And we know there's a lot of state, federal issues going on at the moment that could cause additional delays. So please make sure that we continue to work on those together, and that can help get you some of the basic building blocks and get those pieces ready before we move forward. Go ahead, Lauren.
If I can jump in real quick, it looks like Samantha has a question in the chat.
Where we can find current protocols for test and treat opportunities in Illinois. And that, Samantha, that's a great question, because it's one of the development areas that we're still going to have to build, because and we're looking at other states of what protocols have already been developed. Because we don't have, this is unlike what has been done in like with the contraceptive services or even naloxone. We're not under a standing order. This is going to be our independent authority. So it's really going to be pulling some of this together ourselves to be able to get that rolled out. So we're trying to pull all these resources as quickly as we can. We've prioritized a couple of them to roll out some of the easier ones as we still pull together some of the information. Test and treats kind of in a mixed bag between parts of it are a little easy to get rolled out and other parts are going to take a little bit more time.
It's one area that CPSN USA doesn't have all the details together on too. So we're all working together at the same
Yeah.
All right.
Go ahead.
Thank you. So, what's next? We want to keep these meetings on a regular basis. So we want to have monthly meetings with you guys to check in, see how things are going. When we do, when you guys still, are starting to adopt these programs and opportunities, we want to hear how it's working for you. And that way, when it is a success, because I do believe it will be a success for your pharmacies, to share that success with your peers and with other pharmacists so that they can get involved and feel a little more comfortable. So yeah, we want to keep these meetings monthly, and to have your participation too.
One thing that I'll add, because I know that last bullet point there was on success stories. I see with some of the pharmacies that are on here that, and I know that you guys, some of your operations may actually do cross into other states. And so I encourage you, as part of this collaboration, to help us if you're involved with some of the other CPSNs, help us with looking at what's good to make sure that we're looking at, and where we need to kind of make sure we don't go down where other states have stumbled, and so we can make sure that we're addressing all the issues and trying to do it in the best way possible as we go forward. Because that's one thing that, but this is, whether it's CPSN USA or if we're looking at it from a national alliance with the State Pharmacy Association's point of view through NASPA or NCPA or even APHA, it's the collaboration of everyone's successes of helping us each make better choices as we grow these networks.
So these are just some very minimal resources that we would like to give to you for this meeting, so you guys can check out our I-CPEN website, check out CPESN success stories, and they have a bunch on their website, and it's really encouraging to listen to and see what other pharmacies in different states have done and have accomplished. And then our link to our contraceptive programming and HIV, PEP, and PrEP.
Chad, the test and treat cash is basically that, just as a reminder that test and treat, along with a lot of these other services, can still be provided outside the traditional insurance model, that they can be ran as a cash model.
Garth, in that case, you would bill the NDC. Where would network pharmacies find information on billing for cash?
Well, that's goes back to my other point. We've got to build it. So
Okay,
but there's nothing, that's one thing, is just because it's going to take us a while as we start to provide some of these services before we get all the credentialing with each and every commercial network, whether it's
That's right.
Medicaid and other in-state commercial insurances. But I don't want that to prohibit you at least trying to get some funding in with some of the opportunities where you may have patients who would be available and have the ability to pay cash. Harry, your question, will the programs like HIV PrEP and PEP and everything be included in quality measures, required services within the network? The IPME board has not made a decision on which of those services or if all those services will be required for the Illinois network stores. That's something the IPME board still needs to address. We have not taken a formal vote on that part of it yet.
However, because it is in our scope of practice and in the state of Illinois, and we can provide it, we can deem this as one of our quality measures in that second section. Because other states have like United Health, and they're part of the CPSN network for the United Health or Enliven Health. We don't have that much in Illinois. We have some United Health, which I'm working on trying to get us that, because they pay for blood pressures as well. But since we have Medicaid paying for this and we do a Medicaid, then the PrEP, the hormonal contraception, the test and treat, or any of those advanced enhanced services that we provide can count as our quality measures. So like Harry, you could do one, and Laura could do one, and I could do one, and each of us would get credit for that second level measure, if that makes sense.
Awesome. I'm glad we're having these discussions.
Just to clarify, Harry, as the original 6, they are still required services as referenced earlier.
But the naloxone fits in with our opioid steward system. So.
Right, which was an IPME early decision to add that in at the time whenever we started the network.
Yep.
And that was
So-
before USA had their opioid initiatives.
Yes. So the slide that's up now is the website that gives you all the more of the opioid information, and we'll include that in your information.
Okay, so now everyone take out your smartphone, your smart device. The first QR code on the left is the CPSN USA Self-Assessment Survey. So this is what Starlin was talking about. This is the survey that CPSN is going to use to see where your pharmacy is at. It's very detailed. It is going to take more than 3 minutes because it's more than 3 questions. And like Garth mentioned, you have to look for the state, Illinois. We're in the eyes. You have to scroll towards the bottom. So that's this first one. This is a bigger survey. The second QR code is a survey that the team and I have created. It's a lot shorter, but this will gauge to see where you guys are at as well. It's a little less detailed. We want your feedback. We want to know, where you're at, how you feel with I-CPEN, and future topics that you may want to cover. So I will leave this up for a few more moments. If you guys are having trouble, please let me know.
And as a reminder, you'll be able to scan these when we get the slides in the email as well.
And I can also just attach the link as well if people struggle with the QR codes, because I know I do too sometimes. Any questions so far? One survey per store location.
Yes,
Yes.
it's one survey per MPI I don't think it lets you do more than one MPI on the drop down.
I think you're correct. Yes.
Yeah,
Yes. And okay.
and we'll send all the links and the references that we've referred to in the email back to you guys. With a copy of the video of this too and the slides. Because we want you to help share it with other member stores that weren't able to join, or others that you feel that might be interested in the network. JD, on your question, that's a really good because of your combo shop. I would say whichever NDCs that you currently have under the CPSN USA network would be the ones that'll show up on the self-assessment.
Well, tell me what those are, because I got the spreadsheet open. Okay, so the long-term care facility, we want your information, but you don't have to do the quality metrics for the long-term care store. And if you just signed up in September, October, November, December of 2024, you're also exempt from the 2024 quality metrics.
Darlene, he put his MPI in the chat there for you.
Okay, let me look.
Lauren, if you want to go on to the next slide, if you want to continue.
Okay. Questions.
I was gonna say we've already had a lot of lively questions, which is great.
Yes.
So let me answer JD, that store, you're already have you're transmitting the care plan electronic transmission. So you just need to fill the self-assessment up for that store, for the Williams Brother Healthcare Pharmacy. For that MPI. Okay. Yeah, I can check all these.
And feel free to unmute yourself too.
And feel free to email me with any
Yes.
questions.
Speaking of emails, here's all of our emails. Again, this will all be shared in our follow-up email with the links, the QR codes, what you need to do, what our next steps are, and then when our next meeting is going to be.
And in addition to what we're looking at as we're restarting the enhanced network here tonight, IPME is also going to be looking at other business related services that could be a benefit to network stores and member stores as well. And that can be a wide variety of topics, but and we may have some additional guests throughout the year that could help with providing some additional avenues of discussion, whether we're looking at other business vendors that might be of a key component, or other types of benefit services.
Chad, is that a new store for you?
It's LTC.
Oh, so it's LTC. So it's not showing up on the, because long-term care is exempt at this time. There'll be long-term care measures down the road. They don't have time to do that yet. So you're, it's not listed on the, on their report, but that doesn't mean that I will follow up.
We can connect with you on that, Chad. So
yeah, thank you for, see, they aren't perfect. We aren't perfect. Everybody has errors. It's human.
But I appreciate everyone coming on, being so lively tonight. Are there any final questions? Because we wanted to make sure that we at least tried to provide a brief overview of where we've been over the last number of years, and then kind of where we're restarting here and where our focus is for the next couple of years.
The other thing I wanted to say was we have a memorandum of understanding with one evaluation and management medical service billing. I know people are tired of me talking about DocStation, but they gave us a trial so that we could see, so that we have up to 9 pharmacies, that if your system doesn't have evaluation and management billing, medical billing for Medicaid, for hormonal contraception. I know I have one person on this call that we're going to start as soon as possible because he's the person whose pharmacy actually made it through the enrollment process. So as we get through the Medicaid enrollment, it's not hard, it's not difficult, it's just, it's cumbersome.
Yeah.
And
And that gets to a really key point here, and one of our big asks for right now, because like Starlin just mentioned, we've had one successful member of the network go through. I would like to ask for about 10 of you, and that's pharmacists, not pharmacies, 10 pharmacists for you to identify amongst yourselves or your peers that will be willing to work with us as the next phase enrollees into Medicaid. So look at this as, yeah, it could be a little bumpy and rocky, but it's going to get you in front of the line. That's one thing I like about this process is with us being in the position that we are working with the agencies directly, this puts us where you're going to be first in line before we do more general rollouts or be able to get that out to everyone else. And whenever the references go out and on the website for I-CPEN, I'll try to go in there tonight just to deactivate it, but you'll see a link in there for an old participation agreement sign up. That's not a valid agreement. We've got to get that re-amended for 2025.
is there something that we need to be looking into that we didn't talk about?
You can let us know here or in the forum.
Besides suing government over PBMs.
That's a whole other call.
Just a quick.
No, I know.
Like everybody's gotten their voices choked up tonight with all of this information. Number one, Dave Mike is treasurer for the association. Wanted to thank the staff, members of IPHA and all of those that have had input into this. This is an amazing start. It's not an easy start with everything else that goes on in the association. So for all of those involved, I want to say kudos. And for the rest of you, back them up. Okay, our words are bond. Now it's time to move forward, get active, fire up.
Thanks, Dave. Rupesh, I see that your hand's raised.
Yeah, I had a question about the opioid naloxone program. I know Illinois Advance looks into it. Currently, the NDC numbers for the naloxones that are available in the market, Medicaid, everybody's rejecting it. And the covered NDC is not available in the market. I don't know whether Dave has seen that or anybody else has seen that. But if there's a way we can open other naloxone NDCs that can be covered, because it's slowing down the dispensing.
Shoot me an email on that and I'll send that directly over to Dior.
All right, sounds good. Thank you.
I have a question for you, Rupesh. Have you been able to get a doctor's prescription for a self-monitoring blood pressure cuff?
Not yet.
Because many people are saying that they can get a doctor to write the script, but then when they try to get the script, when they process the script with Medicaid, it gets rejected.
I will double check on that one. I'm sure I can get a script tomorrow.
Because it's the same thing that the cuffs that are covered by Medicaid aren't the cuffs that the physician wants the patient to have because they're not validated.
Right.
Thank you.
And just to let the network know, one of the things that we've identified, and actually thank you to Rupesh, we noticed that the statewide naloxone standing order is due for renewal, and that it actually expires here. What was it, February 8th, I think?
Yeah,
Rupesh?
Feb 8th, yeah.
And so the department was already aware of it. They are in process of revamping or revising it and renewing it. So that will be coming out. The last thing I want to make sure to cover before I hand it over to Lauren, who forgot to introduce herself on her title, because she is our first executive fellow. And that's one of the things we're very thankful for, with being able to, hopefully as fundings continue, to be able to have recent graduate pharmacists like Lauren to be able to help assist us with getting a lot of these new services off the ground. and helping alleviate a lot of the pressures that have kind of kept us spinning a little bit over the last couple of years. But the last thing I want to mention, just quite off topic a little bit of our agenda, but still on topic, is that I want to see each and every one of you on February 26th in Springfield for Illinois Pharmacy Legislative Day. I'm going to give you the same charge that I gave our legislative committee. Bring 10 people with you that have never been to a legislative day before. We've got to fill the dome with white coats and people so that they understand. And I would actually even encourage, if you want to bring patients, we'll figure a way of making it work out for us on the financial side. We need everyone there to understand that PBM reform has to happen between now and the end of session. It needed to happen yesterday, but we all understand, how the process works. But we are in a prime position now to make this change happen, and we've got to push it across the line. I don't care if I look at it as we're going to drag it across the line. So
Y'all better be there. I expect all network people to be there. Bring your friends, bring your white coat. We'll have a good time.
Fire
Yeah, fire up for pharmacy. Okay, so our next meeting, we're deciding every third Tuesday of the month, which would be February 18th at this time at 7. I will look at your responses from the form after you guys have filled out both forms. That's your homework. Yes, I'm giving you homework. I will look at responses to see what time works best, but for right now, we're gonna meet every third Tuesday at 7. So our next meeting is February 18th.